Hi, everybody. Welcome to this new webinar by the International Academy for Clinical Hematology. This is part of our special series dedicated to the impact of COVID-19. And we have started this very popular series now several weeks ago. And we had the opportunity to have wonderful colleagues sharing their experiences, but also the way they are living this crisis. Besides physicians, we had also nurses and other healthcare professionals. And for today, it is my great pleasure to welcome Dr. Carolina Marini from the Hospital San Juan in Porto in Portugal. And actually, Dr. Marini is a relatively very young physician, and she actually has just completed her residency, but we cannot completely say whether it has finished completely or not, because she could not take her final exam because of this COVID-19 crisis. And we know all very well that the young colleagues, the residents, the fellows, the the registrars, the senior registrars, all of them have been extremely involved, and they were really on the front line in the fight against COVID-19. So for this webinar, we thought at the IACH to have a young colleague who was actually clearly confronted to this crisis, not only when it comes to her work on a daily basis, but also it had some impact from an administrative point of view, because as I mentioned, she could not take her exam, and she will tell us her story. So Carolina, welcome, and thank you for joining this webinar. Before we start with the questions, can you just please introduce yourself to all the colleagues watching us today?
Thank you, Professor Mohty, and thank you for inviting me for this webinar. So as you said, I'm Carolina. I just finished my residency late December. And that's about it. I was expecting my specialty exam that was due in March, and that was canceled due to the pandemic.
Okay, so before talking about your experience with the pandemic, can you please tell us about, so I made a broad question, about how was your life before the pandemic? Then it gives you a lot of freedom to tell us whatever you want. But we are much interested on your training, and what were you doing actually before someone announced that, hey guys, this is a health emergency and we have to modify everything. So please feel free to tell us whatever you like.
So actually, as I was just finished with my residency, I was preparing for the exam. So in January and February, I was actually relieved from some of the clinical activities in my department. I was doing mostly consultation and emergency shifts for hematology. And I had like 2 or 3 days per week just to study, to prepare myself. I was doing we have here a practical exam with the real life patient. And I was actually practicing that as well, because it's the specifics for the exam. And I was also 1 or 2 times a week, I was also in the wards. I was also, as a senior resident, I had a certain kind of responsibilities in the wards. I was part of integrating as well the residents that are from other specialties that are doing internships here with us, from oncology and internal medicine. And things were going quite well. I was quite stressed at the time with all the preparation and the stress for the exam, but everything was going according to plan. And then in the beginning of March, the first few cases appeared here in Portugal. And that's when things started to get a bit stressful, because we started to see how things were in Italy, how things were in Spain. And we didn't have many cases in the beginning of March, but at the time it started the talks of canceling the exam and how we're going to do it.
Let me interrupt you here. So my understanding until early March, it was business as usual, routine.
Yeah.
And
yeah.
you were quite happy. You were preparing your exam. And by the way, congratulations for a wonderful CV I have seen. And then suddenly you started hearing the news coming from Italy, from Spain, from other countries, because we have to acknowledge that Portugal has been doing rather well, I would say, since the beginning in trying to contain and control this pandemic. So let me ask you, when talking to your friends, to your colleagues, to your mentors, maybe in your family, with your friends, actually, did you think that it's going to happen, it will come to you, or that was something somewhere else? I mean, what was the feeling?
Yeah, in the beginning of March, we started to. There was this anxiety. Everyone was anxious about the beginning of the cases. They were increasing day by day. The hospital was starting to talk about measures for dealing with the COVID-19, and then we didn't know. I was already stressed with my exam, and then we had all this talk growing and growing and growing, everybody talking about it. And then they started to talk about isolation and closing down schools. And then day by day, there was always a lot of news. There's always something new to talk about. And it all culminated in mid-March when they actually implemented the isolation measures. And then they started to take more action regarding our residency and regarding the exam.
So by mid-March, total lockdown, and then of course the hospitals started organizing themselves, opening ICUs, more testing, etc. You as a junior doctor, were you requested, did the hospital, someone ask you to say, well, you need to be ready, we need you? How did it go?
So at this time in mid-March, all exams were canceled, all internships were canceled, residents got back to their own departments. Even the hematology residents that were in other internships got back.
And by the way, you say it was canceled. How did it happen? They just send you an email or a letter or a phone call? I mean, that would be a big shock, you know, someone sending me just an email or a letter saying, oh, everything has been canceled.
Exactly. That's what happened. We got an email from our residency coordinator, and he told us that everything was canceled. And for example, the interns, the residents from oncology and internal medicine that were in our department got out. They got back to their own departments. And we had these residents, hematology residents, that were in laboratory internships or in pediatrics, and they came back to hematology. The only exception was interns, residents in international internships. I had a colleague that was in Spain that he wasn't required to come back, but otherwise we all came back to our own department. And
but he was probably helping in Spain. I'm sure.
Yeah, I think so. I haven't talked a lot with him, but I think so. Yeah, he's in a transplantation center there, so I'm not sure exactly how they did things there. But back here, our hospital had these measures taken in place with this temporary facilities for emergency care for COVID-19 suspects. And these facilities were, they requested all residents from our hospital to participate in these shifts. And so for a 24-hour coverage, they had only one specialist and 2 or 3 residents per shift. And at the time, there was a bit of anxiety in hematology residents because we did a lot of discussion in our department because of it, because they demanded for the hematology residents to do these shifts, but we maintain our hematology clinical practice as usual with neutropenic patients, with transplanted patients, and we all a bit concerned over this overexposure in this COVID-19 shifts, and then going back to the neutropenic patients. In the end, it was not as bad as we were afraid of, because there's a lot of residents, so we did just 1 shift per resident in the hospital, except for the internal medicine and infectious diseases that they had. They were more involved in that. And even in the COVID-19 wards that they implemented in our hospital, most medical specialties were summoned for these wards, to care in these wards, but not hematology. So in the end, hematology was...
Why?
They did this, how do you say, these levels of importance for the specialties.
Priorities, yeah.
Priorities, exactly. So hematology and oncology were the last one to be called. And
well, I can confirm to you that this is also true in many other countries, and in France, for instance, because obviously, as you said, and you're absolutely right, the hematology patients are clearly at a higher risk of getting morbidity and mortality from this COVID-19 infection. And actually, when we look into the large data set from the UK, just released recently, looking into a database of like 17 million people, if you look to one of the figures, looking into the forest plot and the hazard ratio, the paper wasn't meant for hematology, of course, but it was everybody. But the hazard ratio for hematology in dying and suffering for hematology patients, especially those during an active treatment, was the highest in the series. And in our own experience that we published a couple of weeks ago, actually the mortality was as high as 40%. This is why I think we needed to avoid, to protect the hematology patient, and avoiding the circulation of physicians and healthcare professionals between COVID-free units and COVID positive units, because the virus travels with us. You know, the virus doesn't fly in the air.
Exactly, yeah. And that was the...
Can I ask you one other aspect? You mentioned, and it's clear, you wanted to protect your patient, and you had this anxiety moving between. But what about your family at home, you know, going back home, and, you know, because in a hospital, you are at a higher risk of, theoretically, to see more patients. How did you deal with the family aspect going back in the evening?
Actually, I had a particular experience because I'm married, and my husband, he got COVID-19 from work. He's not a doctor, he's not a health professional, he's an engineer informatics, and he was infected. So actually, I left home for 6 weeks while he was positive. And when I had quite a hard time because my other alternative was to stay with my mother, which is a high risk person. So, and I was working with COVID, and we had all this anxiety going around, and it was quite stressful actually. But in the end, I isolated myself for. I was in isolation for 2 weeks, and then I moved in. I moved in with a sister just to stay for the remaining time because I couldn't come home. But most of my colleagues, most of the residents also had this kind of concern. I know of people that live with their parents that left their homes during this period because they were afraid to infect everyone at home. People with small children also had this kind of discussion. I had a colleague that was pregnant, that she was terrified. I have a few friends that were pregnant in this time, and the fear is real to go home and to go to work and it's very anxiety inducing these times. But
let me summarize it, because I mean, I'm asking the question about the challenges, and it looks like to be a terrible time because your husband got infected. He was self-isolating. He's doing well by now, I hope.
By now, yes, everything's okay. Yes.
Okay. Say hello to him. You had to go and live with your mother, who is an elderly lady, so higher risk, and you are in the hospital. So this is quite
but at the time, my mother
psychologically.
Yeah, actually, my mother didn't stay home. I was alone in her house because I didn't know what else to do. They had here in Portugal, actually, there was this possibility of this, how do you say, for the hotels and the Airbnbs that they made available for health professionals. And I even thought about going to one of those, but in the end, I didn't. But there was also that possibility, but it was very stressful for a couple of weeks until things were calmer. Yeah.
So are there any other challenges you have faced in the hospital? Let's say, for instance, access to ICU for your patient, or how to do the triage, on suspected patient, because hematology needed to remain COVID-free. But then if you have a hematology patient coming with fever, well, this is our daily life, but it can be also COVID. How did you handle all of this? Because you were really on the front line. So you usually, I mean, from my experience, the patient will first call, the resident on duty and say, well, I'm suffering from this and this. How?
Actually, we had, in terms of ICU, we didn't notice a greater difficulty to transfer patients there. I think, yes, here in Portugal, I think we can say we were fortunate among everything, because the hospital they implemented measures very early. They had ICUs dedicated for COVID and non-COVID. And we had a few patients that were in need of intensive care in this time period, and we didn't sense great difficulty for that. In regards to the patient with suspicion of COVID-19, we had a screening method in our ambulatory service that is exactly for this kind of situations. The patient that comes with the fever, that comes with the cough, how do we, they do a screening first before the patient is even in contact with us, with doctors. They go through the nurses, and then if they have an algorithm, and if the nurse thinks it's important to do the COVID-19, they will call us, and then we guide the patient through to get tested eventually. And they have their own circuits, so they don't mix patients. but things have been going well. I don't think we don't have a lot of patients COVID-19 in our service. We didn't have any in need of intensive care in this time period. The only patients we had COVID-19 were not intensive care, so it was easier to manage. But for example, in our unit, we don't have a place exactly for the COVID-19. They have a separate ward in another part of the hospital, so they don't cross. These patients don't mix. But yeah, things have been going well. They are well organized, at least.
So I know, you know, in terms of education, I have crossed by you in different meetings, and I know you are very eager on learning, and actually you also write very nicely, because I have noticed your recent paper published on PubMed a few weeks ago. So well done. So during this lockdown, during this emergency, and even still today, because anyway, we're not traveling, how did you continue your continuous medical education? Were you attending any lectures, web-based, or were you following the webinars? Maybe you were following the ICH webinars or other educational tools. How did it work, and how did you as a community of residents and fellows, how did you organize yourself to continue this educational process?
Actually, I think things have been very calm in that department. Just recently, it was just in the beginning of May that the isolation measures began to relax a bit. So just now we've been talking about this. We're restarting to talk about webinars and about continuous education. For example, I have a colleague that she was due to begin her PhD program in April. I think it was April, and it was delayed because the laboratory was closed. So only now laboratories are opening up again, and things are beginning to restart again. And mostly, in the meantime, I have news from my exams, so I'm starting to focus again on that. And but we haven't had many. There isn't much attention to that kind of education so far. I believe the next few weeks things will start to pick up again. But so far there hasn't been much dedication to that, and but we'll see next week.
So the focus were purely and exclusively on the clinical work. So we have, and I think that is fair, because in a time of a crisis, although we need to learn all the time and continuously, but definitely I think patient care is a priority. But if you want to improve patient care, you need to rely on a good education and continuous,
of course, yes,
medical education. So that brings me to my next question, which is, now maybe life is starting to
go back to normal.
Well, I mean, I don't know. It depends where you are, because normal maybe in Portugal, but
maybe different. Yeah.
It's true everywhere. Unfortunately, some countries are still, I think, struggling with this pandemic. And I'm not sure that we will get rid of this virus immediately.
So soon, yeah.
But also in many places, in many countries, and we'll see what will happen soon. Everybody is anxious about this so-called second wave after the lockdown has been relaxed and so on. So we cross our fingers that nothing bad will happen, but who knows? So how do you view, as a young physician, your this post COVID-19? What did you learn? Are there things now that are more important to you or less important? What will be your focus? How you, or you can tell me, it will be okay and everything is back to like before, but I'm sure this may not be your experience.
Yeah, like you said, I think things are different and they'll remain different. We will never see the same way a patient with a neutropenic fever, with a cough, we had even the other day, I had a patient with a pneumonia, a typical bacterial pneumonia, but we had to do the COVID and she had to be in isolation, and we had all this new circuit for these patients that is not the same. And things I don't think will be the same for quite some time, maybe, yeah.
And here you're bringing something which is very important, which is the burden, the additional burden on our patient who are already struggling with a nasty hematologic malignancy, and they have to face and cope with this permanent risk of getting infected with COVID-19.
Exactly, with this fear, patients, and it's not only, I had patients that don't want to go home after their treatment because they're afraid. They're afraid to be home, they're afraid to leave the hospital. And then you have patients on the opposite, patients that don't want to come to the hospital, patients that don't want to be admitted for treatments because they're afraid, and they're afraid at home, they're afraid in the hospital, they're afraid everywhere. And we have to deal with that anxiety. And we haven't had that many consultations in person. We're doing a lot of teleconsultation. So patients have our number and they call us and they call us and they call us because they're afraid and they're anxious. And then we're anxious as well, because if you have a patient by the phone, I had that the other day as well. You have a patient on the phone and the patient says they have a fever, and then you have to say, okay, you need to be seen, but you can't just send the patient. You have to think about what is the circuit the patient has to do and how serious is the situation. And I think everything's a little bit harder right now because of that. And of course, now things are returning a little bit to normal with the in terms of education, in terms of residency. Internships are starting again and people are going back to laboratories, but everything is different at the same time. So I'm not sure. For example, I have my exam scheduled for late June. But let's see, because right now I'm expecting everything, because if you have a second wave and the second wave is in June and everything goes on isolation again and the exam is canceled again, so we don't know how things are going to go. But now I believe we are a bit more resilient, because in the beginning, I remember in March, everybody was anxious, everybody was nervous. Every intern I knew, every resident I knew, even in our hospital, we have meetings. The board had meetings 2 or 3 times a day, and they sent this load of emails with a lot of new information, new measures. And I believe now people and the hospital and the population is better prepared. I like to think so. At least we'll see how it goes. But I think things are better prepared for a new peak, or for things to get bad again. But I think that actually we'll see how things go. Because in the
So, assuming, let's be optimistic and think uh, things will go well, I hope, and you are allowed a week of holidays to rest and so on. So, what would you love to do during this week? What are your projects?
oh my, I don't even know we can go anywhere, so we have to stay here.
So actually, you
But
get used now to work 7 days a week, and
yeah,
actually, and not go anywhere.
yeah, because we don't do anything else. No, but actually, I don't. I can't even review or expect what will be the next few months or how we'll change. For now, actually, my concern right now is actually my exam, so that I can. Because that's a big part coming, and this exam is also essential for our how do you say, to afterwards for the to get a new, just to continue in the career. That's what I mean to
Absolutely,
say.
to
Yeah,
move forward and get a
to
new
move
position.
forward.
Well, yeah,
Exactly.
you need to go
Exactly.
through all of these steps. Well, Carolina, that was really fantastic. Thank you very much. I have really enjoyed my discussion with you, and I think you managed to tell us your experience about such a very bad crisis in a very positive and a smiling way. And I think you pronounced the right word about, for me, which is the best conclusion, which is about resilience. And I think we will manage all together. We will go through this crisis, and we are extremely grateful to you, young colleagues, because you are the beating heart of our hospitals, and we count on you. So thank you very much. Thank you all, wherever you are, for joining this special webinar by the International Academy for Clinical Hematology. We will not take questions because Dr. Marini is on duty tonight and she has to rush. But I'm sure we will have other opportunities to discuss and hopefully to meet in person. So thank you all very much, and wherever you are, have a good day, have a good night, have a good evening, have a good afternoon. Thank you very much.
Yeah.